Periodontists often work in conjunction with orthodontists to help facilitate their treatment. There's a variety of procedures that we do for the orthodontist. Everything from a procedure called a frenectomy, which involves removal of gum tissue, to a tooth exposure, which means exposing an impacted tooth. So what I'm going to do during this segment is just outline each of the procedures. To begin with, a frenectomy is where we remove a frenum. A frenum is a piece of soft tissue between two teeth that often contains a little bit of a muscle fiber component. Orthodontists often want us periodontists to remove that muscle fiber component because if left untreated, it can sometimes lead to relapse and respreading of teeth that were spaced apart. An orthodontic tooth exposure is where a tooth is impacted and hasn't erupted into place on time. So us periodontists will actually surgically expose the tooth by removing gum tissue and some of the underlying bone, even attaching a bracket, an orthodontic bracket, to the exposed tooth so that the orthodontist can apply force and move the tooth into place. We also do soft tissue grafts because during orthodontic treatment, because teeth are getting shifted and moved around, sometimes the gum tissue is thin and it needs to have an extra tissue to help increase the thickness of the gum tissue. Sometimes during orthodontic treatment, an abundance or an extra amount of gum tissue around the teeth occurs. And in order to help facilitate oral hygiene and also to have a cosmetic effect, orthodontists request for us periodontists to remove the excess gum tissue, also referred to as a gingivectomy. Each of these procedures is done under local anesthesia, and they're all done just here in the dental office. All of them are done usually in a range of 30 minutes to an hour. The area will be sore for at least a day, sometimes up to 2 days. So we won't want your child to be in school for that day, and they may even have to miss an additional day of school. We'll be reviewing some specialized instructions on home care, including how to take the medications, brushing instructions, and even what they can and can't eat. In addition, because some kids can be anxious, we offer nitrous oxide and even some other sedative options to help take the pressure off. Overall, all of these periodontal procedures for the orthodontist are very safe and effective and have results that last a lifetime.